Awesome.
I think he was talking about regular shower when you pray. Regular shower, general boils, Dr. Byers.
He's rehearsing.
Huh?
He's rehearsing.
Rehearsing? Yeah. Yeah.
Scott, you don't want Yeah, they're all just in a circle talking.
Good afternoon, and thank you all for joining us today on Monday. We celebrated a major milestone over the weekend with more than 100,000 Mississippians receiving vaccinations for COVID-19. That's something we can all be proud of as we work together to get even more access to even more Mississippians. In fact, we have administered 105,228 first doses. We have 9,719 Mississippians who are fully vaccinated. So we've administered 114,947 total doses in our state. We went in a relatively short period of time from being 50th out of 50 to scheduling every vaccine that we possibly can. Now, I know that a lot of people have had trouble with the website and have had trouble with the call center over the last week. And I'm, just like you, not happy about that. But I also realize that that is the nature of launching a product that so many people want. We can't get everyone their shots in the exact place that they want them at the exact time that they want them. We can get all of the shots that we have out as quickly as possible. And we can give as many people as possible a chance to get in line. And that is exactly what's happened. Tens of thousands of Mississippians were able to get through and get an appointment last week, and we're delivering those doses as quickly as we possibly can. Regarding those customer service issues, Director Michelle will have more details later, but his team worked tirelessly over the last week and all weekend, working with the team at the Mississippi State Department of Health, the University Medical Center, and other IT experts. They have made tremendous progress. In fact, late yesterday, the website was surge tested, and it was able to handle 6,000 users simultaneously hitting the site every single second. Nothing shocks me anymore, but we should not have significant additional issues going forward. The call center was tremendously bulked up. I believe I heard the term quadrupled in size, with more lines and more people to communicate. I cannot promise zero wait for everybody, but I can say that there should be less of a wait for everyone. We are opening more locations and loading more appointments as we speak, including 1,200 doses at drive-through sites in Hinds County. Our partners in clinics, hospitals, and FQHCs will get an additional 5,800 doses this week. Those are first doses. In addition, there are currently 144 hospitals and private clinics that have approximately 50,000 doses that can be put in arms this week. Of those 50,000 doses, approximately half of them are first doses. Now, here are some of the remaining limits on our abilities going forward, at least as I see them. Number one, we can give out as many vaccines as we're given, but we can't do more than that. I promise to do everything in my power to get every single dose out, but there are still more people who want a vaccine than there are doses available. So we do still need to recognize that and exercise some patience. This week, for instance, we have 37,000 doses already allocated to us. We are working to get additional allocation by moving some of those that are currently allocated to long-term care facilities over to our general population. In the analysis that we've done, and I'll be happy to answer questions about this, it appears that the federal pharmacy program over-allocated to that particular program relative to the number of individuals that are actually going to take it. We've already convinced them to give us an additional 5,100 doses, and we hope to get about that many more this week. We're working through that process. But still, we can't give doses that we don't have. Because of that, all told, we've got 37,000 doses that we were originally allocated. We've got an additional 5,100 coming, and there are approximately 25,000 first doses at either hospitals or private clinics throughout our state. So our maximum capacity this week is approximately 67 to 68,000 first doses. We won't get all of those in arms, but we're going to get a large majority in arms this week. Number two, we have to be flexible and adapt as we learn more, and we have to be guided by data. I just got the information on every one of our partners that is distributing the vaccine on Friday. When I say partners, as you know, there are 4 different avenues of distribution here. There is the federal pharmacy program, which is doing long-term care facilities. There is number 2, the state-run clinics, which is a partnership between Mississippi State Department of Health, MEMA, and of course our wonderful men and women of the Mississippi National Guard. Number 3 is our hospital program, and then number 4 is our private clinics. There's approximately 147 on the list. When I got it on Friday, approximately 94 of them, almost 2/3, had given out less than half of what they had been allocated. So just about 29 of them were actually above 65%. So we made the decision that this week we will only send additional vaccines to those providers who have given out at least 65% of their current doses. The vaccines that we don't send to sites that are falling behind can be used to support sites that are efficiently getting the vaccine out, whether it's our drive-thrus or a hospital or a clinic. Let me be clear, I don't care as long as it gets done and as long as shots get in arms of Mississippians who want it and who need it. And I will tell you, we have seen many of our hospitals and many of our clinics do a great job, and we certainly have gotten nothing but positive feedback from our state-run facilities, particularly those men and women from the Guard who have done logistics, those medics who have put in shots, and those staff of the Mississippi State Department of Health who have helped make that run smoothly. Number 3, we still need to finish our nursing home vaccinations. That plan was negotiated by the federal government. But last week I got on a call and spoke with both Walgreens and CVS myself to have a conversation about where we found ourselves. They continue to tell me that we're on the track for most all of our nursing homes to be served by the end of this month. In fact, I have fairly significant data now which shows that approximately 95% of all nursing home residents will have access to the vaccine by the end of this month. What we're seeing there, and I said this last week and I'll say it again, somewhere between 75 and 85%, this by the way is a national issue, but somewhere between 75 and 85% of all nursing home residents are opting to take the vaccine. Somewhere in the neighborhood of about a third of all employees of nursing homes are actually choosing to take the vaccine. That's a challenge that we're going to have to work through in the coming months. Number 4, as we move particularly into next week, we have to prepare for more second doses and to expand first doses to our first responders and our teachers. Many of them fit into the category of the most vulnerable, and some of them qualify by age, but quite a few do not. So we want to make that expansion as soon as we can, but we're not there yet. Mississippi is achieving something incredible. We're all a part of this effort. I can promise you that we will work without ceasing. We will do everything in our power to eliminate every roadblock and open access as quickly as possible to everyone. We will rise to the occasion and we will protect as many people as possible. There is no higher priority, and we're acting accordingly. I want to thank again the men and women that are working long hours to make this a reality. The employees at the State Department of Health, the employees at the Emergency Management Agency, our men and women of the National Guard. I will tell you, we had a meeting in my office approximately 2.5 weeks ago with stakeholders in each of those entities and agencies. And what I said to them then was that I wanted us to approach vaccine distribution as if a hurricane was in the Gulf and we were going to take a direct hit. I wanted us to do everything in our power to expand not only the number of shots in arms, but also the number of vulnerable Mississippians that we protect. And what's happened over the last 2 weeks is people all over this state have stepped up and they're making a difference. Now, we're not where we need to be, and we got a long way to go. With 100,000 Mississippians vaccinated, we've got hundreds of thousands more to do in the coming weeks and months. But I want you all to know that there are an awful lot of Mississippians that are doing everything in their power, doing everything possible, working long hours to get this vaccine distributed, and I, for one, am proud of them. We've also seen positive movement in terms of total number of new cases. We've seen very positive movement over the last week to 10 days in total hospitalizations, total number of patients in ICU beds, and as well as total number of patients on ventilators. That's very positive. And so we have Dr. Byers with us here today. Dr. Dobbs is otherwise occupied. I think he had a meeting with the Surgeon General perhaps. But Dr. Byers is obviously right in the middle of it and will do a great job giving us an update on where we find ourselves. Dr. Byers, thank you for being here.
Thank you, Governor. So today, as y'all have seen, we're reporting out an additional 1,457 cases and 3 deaths. I would caution you with the 3 deaths. We've seen some low numbers of reported deaths over the weekends before, and we feel like that's primarily a reporting issue. If you remember, last week we reported out 98 deaths, highest one-day total that we've had so far. And those were reports that we received on the Monday after that weekend. So we are still seeing deaths in Mississippi. We are still seeing numbers of cases in Mississippi. We hope to see some moderation in both of those in the coming several days. I think that there are some indicators that show when you look at that we may be on the verge of starting to see some declines in the state. I think a lot of that may have to do with us getting past the holidays, hopefully, and we'll see that we'll have a decline in the number of cases and deaths. But remember, when we have a big surge in the number of cases, typically we will see those deaths that occur anywhere from 7 to 14 days after those increases in cases. So, you know, we're not out of the woods yet. We still need to do those things. In addition to broadening the availability of vaccine and getting as much vaccine out to our partners and through our drive-through clinics as possible. We want to make sure that people still understand that they need to do those things that we've talked about for now almost a year, wearing your mask, social distancing, avoiding those large gatherings, trying to pare yourselves down to those essential services that you need to do. We are still seeing an impact in nursing homes, obviously, and we have had, at last report, over 150 outbreaks in nursing homes. But when you look at those, a lot of those are 1 and 2 cases in nursing homes rather than some of the larger numbers that we've seen. And certainly we're not seeing nearly the impact in deaths that we saw in nursing homes early on. We are working with the governor and working with MEMA and the National Guard to get those doses out that we receive from the federal government on a weekly basis out as quickly as we can. In addition to getting those first doses out to support our drive-through clinics, we, as the governor said, have made a modest amount of vaccine that we had available to our partners that we sent out to several clinics. We hope that that's not only going to broaden the reach and availability, but also to address some of the disparities that we're seeing with who's getting the vaccine, and that's very important at this point. Moving forward, we're going to ensure that not only are the first doses sent out, but for those facilities that have received those second doses, it's important for us to get those out as quickly as possible to those facilities so that they can ensure that the people that they've vaccinated with the first dose have the opportunity to receive that second dose as well. It's important for people to get both the first and second dose to make sure that we are fully protected. Governor, that's my report for today.
Thank you, Dr. Byers, for your courageous efforts and for being here with us today. At this time, I am going to turn it over to Director Michelle, who will give us some updates from his perspective.
Thank you, Governor. Just real quick to address Governor Reeves' comment on the website. Yes, there was an extremely amount of work that was done over the weekend getting the website stood up to handle the amount of surge that we can anticipate not only today, but over the course of the vaccination schedule as we increase the number of opportunities. I do want to say that along with members of my team that it was a phenomenal team effort from the Mississippi Department of Health, individual at the University of Mississippi Medical Center, and ITS all worked extremely hard and long hours this weekend, so really great job. And I'm very confident that the user experience on the website will be much different from this point forward. I do want to point out that the intent was to be able to give the user the opportunity to view available appointments as they enter the site, as opposed to going in a queue in a waiting room and waiting to see it. So it should be a much quicker opportunity to get in, see what's available. If nothing is available, get out and then come back later. Also with the call center, again, users should expect a better experience now as far as busy signals. You should not get busy signals. What you may find is a longer wait time, depending on where we are in queue with appointments. But you should not experience a busy signal, and your wait times, even with a wait, should be much lower at this point. There were 20,000 appointment opportunities were loaded today. That includes one additional day for Hinds County this week was added, 400 appointments, and then next week there are going to be 3 days in Hinds County. That was a great demand that the call center reported. So it'll be the 3-day vaccination sites in Hinds County for a total of 1,200 appointments there, and then all total 20,000 opportunities loaded today. Just a real quick, also, with their 19 locations that the National Guard is doing that are manning those sites, some of those site locations have been modified to increase throughput. So we're looking at vaccinating 30,400 this week, and then with the addition of the Hinds County sites, 31,200 next week. So again, we continue to ramp up the opportunities. Finally, just to remind everyone about how to register for an appointment. You've got 3 ways. First of all is going online to the website. That is going to be what we recommend you do first. That is COVID vaccine. That is covidvaccine.umc.edu. If that site does not work for you, do not have access to the website, the call center number is 1-877 978-6453. And then you can also contact hospitals and clinics directly to get appointments. You want to call them directly. Do not go to the website or the call center. That is only for the drive-through clinics. Other than that, Governor, that includes my update, sir.
Thank you very much, Director Michelle. I appreciate your team's effort and the collaborative work that was done over the last week to increase capacity. I know we were here, I believe, last week on Monday, if I'm not mistaken. As you know, there was snow on the ground throughout much of Mississippi last Monday morning, and there were men and women of the Mississippi National Guard that were standing in that snow directing people through sites so that they could get their shots on Monday. And I personally want to thank them. We've worked with General Boyles to look for opportunities to expand the number of medics that we have available, because as we move into the next couple of weeks, we're not only going to have first doses and first dose appointments that we're running through our own sites, we're also going to have second doses coming online with both Pfizer and Moderna. And I have not been told if this has changed, but we do currently believe, and Dr. Byers, correct me if I'm wrong here, but we do currently believe that if you got a first dose Moderna, you need to get a second dose Moderna. If you got a first dose Pfizer, you need to get a second dose Pfizer. And so part of that is incumbent upon us to make sure that the same facilities get the same specific vaccines, but part of it is on you as well as the people to not only know that you have received a card that has what that dose is, but we'll work on that as we move forward. But I want to thank General Boyles and his team and turn it over to him, please.
So, Governor, I'll just simply say we've got a little over 1,000 men and women, both Air Force and Army, that are on duty today working 15 sites. We're not testing today, but I'm sure we start testing again tomorrow. I'm pleased with the way the traffic moves through the sites. Governor, I will tell you that we have capacity to build on that and to keep the traffic moving efficiently while we're adding more lanes and more opportunities for folks to get shots. So we've got that capability there. My limiting factor is space, as you might imagine. So we're working on that. It's also medics, and I believe we've got a good solution for you on medics also. So I don't think we're going to have a limiting situation at the sites. It's just how many shots you won't put in arms. And you're right, we are prepared to work through inclement weather. We do have some inclement weather coming in this weekend, but we plan to be there to put shots in arms on Thursday and Friday, Governor. The last thing I'll leave with you, what I've learned in my travels on the sites too, is that we are prepared to mitigate against the Moderna and the Pfizer, the different shots that need to be done at any given site, and that's a very simple solution by putting people in one line for one and one for the other. So we're discussing all those scenarios, and we're prepared to respond accordingly. Governor, that's all I've got for the report.
Thank you, General Boyles, for you and your team. With that, I will again thank everyone and open up to questions. Scott had his hand up first, I'm afraid.
Governor, is there a uncertainty about a vaccine flow for the state? Because last week we got a statement from the health department how they were world changed within 24 hours, and seemingly the implication is they were not prepared for what we asked for or demanded last week. What are we looking at going forward in getting and securing vaccine medicines?
Yeah, I don't think the world changed last week, but what I will tell you is there is always uncertainty in terms of how much vaccine we're going to get on a weekly basis as it currently exists. We typically learn sometime early to the middle part of the week what we anticipate that we're going to get the following week, but we're not able to order it usually until Thursday evening for the following week. And so we think that the number of doses should be fairly close and in line. But just like this week, we're looking for opportunities to press that. For instance, as I mentioned earlier, we got 37,000 doses allocated. Half of those, by the way, are Moderna and half are Pfizer for this week for our state-run plan and for our partners. But we're trying very hard to repurpose an additional approximately 10,000 of those that were currently allocated for the long-term care facilities, because we think that particular program is over-allocated. And so we think that particular program is of utmost importance because, as Dr. Byers mentioned earlier, the number of fatalities that we had early on, and it's a congregate setting. It's typically people who are older and typically people in a lot of cases that have various comorbidities. And so the long-term care facilities create as much risk as any. So we want to make sure we have 100% of the doses available for them to get in arms as soon as quickly as possible. But even so, the way in which the federal government counted that particular program, in our view, they just over-allocated there. So.
Yes, Governor, for people who are listening right now, y'all talked about how y'all are expanding the website, getting that ready for high surge traffic. But does that mean that there's stuff right there? There's appointments online right now to go get? And if not, when should people be coming back to check the website to see if they can schedule an appointment?
Well, there are a lot of people in Mississippi who watch these 2:30 press conferences, and I'm sure some of them that are watching now are already on the website and are already making phone calls. I have no doubt about that. But yes, there are appointments that are being loaded as we speak, and so there will be appointments available at our state-run sites the week of 125, which is a week from now. Our logistics team with health and MEMA and National Guard laid out that plan at their Sunday meeting yesterday. And as that plan is finalized is when we can then add those appointments to the website. But we had 30,000 appointments for this week, Monday through Friday. That's the week of 118, so that's today through Friday. They were taken up very quickly last week, and then we're doing the same thing again next week, with the exception of we're adding one additional site in Hinds County, which I think you said can do 1,200.
It's going to be scheduled for 1,200 next week. Yes,
1,200 next week. So those should be on the website either now or over the next several days. But I'll also tell you, and this is what I want everyone to know, is that there are appointments that pop up from time to time throughout the week. So, for instance, we find ourselves in a position in which, whereas we're more efficient than most, but if we get 32 or 33,000 appointments, right now that means about 30,000 shots will get in arms. We're running between 93, 94, 95% of the people are showing up. But because of that, we also have some people who have probably gone online and they have scheduled an appointment for next Monday, and then one pops up on Tuesday, either at a local private clinic or at a hospital or at a state-run site, and that person changes to get, and then that frees up an appointment for next week. So there are pretty regularly appointment availability on the site throughout the entire week. And as our goal is, if there is an appointment, that means there's a shot associated with that appointment, and we want that appointment full, period. Yes, sir.
Thank you, Governor. Dr. Paul Byers' question is for you, if I may. So we just heard a lot of updates and analysis from the governor and MEMA standpoint. Still, last week we heard from the Department of Health that we're not going to get a delivery till mid-February, or people can't schedule new additional vaccines until mid-February. So from the Department of Health standpoint, what exactly changed to knock that all the way to January 25th? Then I have a follow-up, if I may.
Absolutely. No, there was never not going to be another delivery through February. That was, as we've opened up more appointments, we've had more available, as the governor said. So, no, we get an allocation of vaccine on a weekly basis. As the governor indicated, sometimes we don't have complete visibility on exactly the number that vaccine is going to be. But we have a pretty good idea, and that helps us with planning purposes. So by that Thursday, we're able to order those and get them distributed. However, as we open up appointments on the scheduler, we do have vaccine for every one of those available appointments.
Okay, good to know. And my follow-up is, can you elaborate again? So 144 hospitals and private clinics now have 50,000 doses to give. How can people schedule those appointments? And is there any way people can go to the Department of Health's website to see where these hospitals and private clinics are located, which ones are giving out these doses?
Gosh, that's a great question. And so, and you know, we've sent out some additional doses as well. As the governor indicated, we had some that we, after we had supplied all of our drive-through clinics, we had some additional doses available that we're making available to other private partners or external partners to the Department of Health. And so we're going to work on that list, and we are going to get that published so that folks know where they can go to get a vaccine in addition to our drive-through sites. You know, a lot of the places that have that vaccine available are doing some of their own advertising as well. And a lot of them have made it available into their community where they have their own websites where you can go on and schedule an appointment with them. So we're going to be working to make that available so folks know where that is.
So there is no list right now, but you are working to make
Absolutely.
it a statewide,
Yes.
on the health's website?
Yes, yes, absolutely.
Scott?
How many of the providers are not meeting that 65% margin? Can you ballpark it, say 50%?
2/3 are under 50%. As of Friday. Now, I will tell you that as it has become more and more clear that we are only going to resupply those clinics that have exhibited an ability to get shots in arms, then we're seeing more and more effort over the last week or so getting shots in arms. And so I'm hopeful that many of those 2/3 that were under 50% last week on Friday are doing better now, and I'm very hopeful that if they have approximately, and by the way, just I want to make sure we get accurate information. There are 50,000 doses available at hospitals and private clinics as of Friday, but only about 50 to 60% of those doses are first doses. And so, again, the others, the second doses are allocated for those that have come before them. So you're talking about 25 to 30,000 first doses that should be available this week. That's why I talk about what's our total ability to get shots in arms this week. It's the 37,000 that we've had allocated, plus the 25,000 that are out there at private clinics and hospitals. So that's approximately 62,000, plus what we're trying to get another 10,000 repurposed from our long-term care facilities, so that would be 72,000. But so far, we've only gotten 5,800 of those 10,000 repurposed, so knock about 4,200 off that 72,000, and we're at 67,800 is sort of the most first doses that we can get in arms this week. If we get 67,800 first doses in arms by Friday, or even by Saturday of this week, that will mean that we will have gotten approximately 100% of all first doses that we have received in arms. That's our ultimate goal, is can we, because I hear a lot of folks, and we talk about it, we look at how we're doing relative to other states. It's part of the measurement process. I firmly believe that what gets measured gets done. And so we believe in the measurements, and we look at ourselves versus other states. But our real goal is 100% of the doses that we can get in arms in the most timely fashion possible. And if we could get 67,800 in arms this week, then that would mean we were really close to 100% of everything that we've gotten. So,
Hines County, I'm sorry, where's the Hines County location going to be?
Smith Wills Stadium.
Dr. Byers, I wanted to follow up on a question from my colleague here. I think kind of what he was talking about was the miscommunication last week. Initially, the Department of Health had said in a late day press release it wouldn't have any more appointments available until vaccinations arrived in mid-February. That same day, though, the governor said on social media that it wasn't true that no shots were available for at that point. And then, of course, MSDH came out saying there would be additional appointments available. It seemed like you guys weren't on the same page. That's what it seemed like to members of the public, because we're getting calls at the station saying, hey, why are you saying this? And then somebody else is saying one thing. Just wondering kind of what happened when the communication breakdown last week.
I'm not real sure what exactly happened down with the communication breakdown, if it was a communication breakdown, but let me just tell you, certainly it wasn't an intent to say that there weren't doses available. And certainly it wasn't an intent to say that we weren't going to be able to make any additional appointments. We work closely with the governor's office, and we want to make sure that not only can we expand those appointments and have a slot available for those folks who want to be vaccinated, right? But we want to ensure that we have the vaccine that can go in those arms. So we got to match that up, right? And so we're working on that, and we're going to continue to work on that, and certainly we'll make sure that our communications are clear regarding that.
And I have one additional question for you. It was something you brought up earlier, and I just wanted to ask you about it. Concerns that some won't take the vaccine, particularly those numbers you mentioned with the long-term care employees. I think you said, 1/3 said they would be willing to take it, but, at what point, that's obviously not ideal. Is there ever a point where those employees would eventually be required to take the vaccine if enough don't voluntarily get vaccinated?
Well, we talk a lot about this. Right now, our number one limiting factor going forward, this has not been true up to this point, but going forward, our number one limiting factor is supply of vaccine doses. At some point, and I think it's going to be many months from now, but at some point, our limiting factor is going to be demand for the doses that we have, because we know that there's some percentage of the population that is less likely to take it than others. And so what I would say to you is I'm hopeful that as we go month after month and more people get it and fewer people are having any major reactions to the shot. And I will tell you, as you saw, I received it last Tuesday or Wednesday, I forget the exact day, a little bit of arm soreness, but certainly nothing major. We've heard that from folks. Dr. Byers can tell you sort of some of the anecdotal 1 or 2 or 3 cases where they've had challenges, because I heard him talk about it on the state medical call on Friday afternoon. I'm certainly not capable of doing that, but very, very limited bad reactions at this point. I'm hopeful that will mean more and more people will take it. What I am told in my conversations with the CVS and Walgreens teams that are doing the long-term care vaccinations is what they are seeing around the country particularly is about 1/3 of all workers at long-term care facilities take it the first time. But you got to remember they schedule the first vaccination, then they also are scheduling coming back 3 or 4 weeks later to do the second vaccination. What they're telling me is there's a pretty large number of workers that are getting the first dose when they come back to provide the second dose to everyone else, because they've seen their friends and their neighbors and the people in the facilities that have gotten it and haven't had any major negative effects. Again, in Mississippi, the limiting factor right now is supply. At some point that will shift to where the limiting factor is demand, but I believe we are months and months away from that. Yes, sir.
Governor, for the clinics that are offering the vaccine, if they do cross that 60% threshold, when will they be able to make another order for vaccine doses if they were lagging behind that 50%? And then Dr. Byers, are there any ordering requirements for maybe a clinic who's hoping to start administering vaccines in the future?
Yeah, okay, just to be clear, 65% is what we're making available, 65%. We hope to have as many as 10,000 vaccines for them, but we feel confident we'll have 5,800 this week. This is an evolving process, and so as more and more shots get in arms, we will have hopefully more and more people that will become eligible, and our distribution to those private clinics and hospitals will be dependent upon availability. But again, since the hospitals particularly started the vaccination process in the middle of December, a lot of them now have either primarily staff, but we'll start seeing more and more community members, but primarily staff that now are available to get the second dose, and so they will certainly be receiving those at the appropriate time. Dr. Byers.
Yes, sir. And you know, the biggest requirement for a provider to be able to administer the vaccine is for them to enroll as a COVID-19 vaccine provider with the Department of Health. And we have over 800 providers that have enrolled in the state. But again, as the governor indicated, the limiting factor is going to be the supply of vaccine that we have to distribute to those providers right now. And so, you know, we're looking at our drive-through clinics as the priority, but we're also taking those additional doses and looking geographically where we can send the rest of those doses out to those providers. especially the ones that are already demonstrating that they're getting the shots in arms for the vaccine that we've given them.
Thank you, Bailey. Thank you, Governor. 2 questions for you, Governor. The first one would be, is there a region or an area in the state that is lacking of the amounts of vaccines that have been distributed that have not had either the health departments or the hospitals give out as many has been given to them? The second question is, and even though it was really good to see you on the appointments last week in Gulfport, I did forget to ask you the question about the state port. There has been a vacancy for the executive director position for about, I guess, 6 months or so. I may be a little wrong with that. Is there any indication of any resumes or anything like that that you are thinking about? Because especially after Hurricane Zeta and a lot of the damage in the area. Thank you very much.
Thank you, Hunter, for those questions. It's good to see you late last week. Yes, the state port is doing the board of the port is doing a national search, and which obviously takes time, and we are looking at a lot of exceptionally capable individuals with respect to that, and hopefully there will be an announcement forthcoming sometime relatively soon. I will tell you, I think that particular job is a very important job for our state, but it's also a great opportunity for someone who wants to run a premier port. Mississippi, it was just announced in terms of job recovery from COVID-19 back in March, is recovering at a rate that is the 3rd best in America. And I'm certainly proud of that, and I believe our economy is poised to grow very, very quickly. With respect to any particular geographic region in Mississippi that is doing better or worse in terms of percentage of getting shots in arms, what I will tell you is there's certainly been, in your region on the Mississippi Gulf Coast, you look at the total number of vaccinations done in Jackson County, Harrison County, and Hancock County. It is a very good number. Both Gulfport, Memorial, and Singing River systems were well above that 65% number. I know those 2 off the top of my head because I'm sitting here looking at the doses ordered and the doses administrator list. I know that both Gulfport Memorial and Singing River systems have done an excellent job. You've got hospitals like Magnolia up in Alcorn County, which again is above that 65% level, which is very, very positive. And again, those are 2 systems on the absolute southeasternmost point of our state, and one in the northernmost point of our state. In terms of who's doing particularly bad, there's no geographic reason for that, and hopefully those who showed up at the bottom of the list last Friday will show up at the top of the list this Friday. Everyone has the opportunity to do that, but what we're not going to do is we're not going to send more doses to those who have not administered a very high percentage of the ones that they've already been allocated, because that's not fair to people who don't have shots in their arms. Scott.
Governor, all eyes on the inauguration Wednesday and the security preps that have been taking place. And we've seen a lot of security movement around the state capitol. Can you address that and what the state is doing just to make sure everything goes cool here?
Yeah, well, let me be clear. I strongly support anyone's constitutional right to protest as long as they do so in a peaceful way. And what we saw over this past weekend is that even though there was wide reports circulated throughout America of significant activity on Sunday, which was yesterday, at least in our state, we did not see, it was basically a non-event. That doesn't mean that we're not prepared for today and tomorrow and Wednesday, but yesterday at least was a non-event. What we saw back during the summer with the Black Lives Matter protests that occurred throughout our state and really throughout America is they turned pretty nasty in a lot of parts of the country. We had very large ones in Mississippi, 4,000 or 5,000 strong outside the governor's mansion. Very little, if any, violence that I am aware of, and I hope and pray that the same will be true this time. But as I said last week, we are prepared. Whether you see us or not, we are there. We are watching. We are going to be prepared to protect not only the property in and around our Capitol, but also the people that are in it and the people that work in this particular complex. If you were here yesterday in downtown Jackson, I think there was one counter-protester who showed up and a little bit of press, but I didn't see I didn't hear of any real protesters that were here. So, if you did come down, if you're a member of the press and you were here, I think you probably felt a larger presence from the standpoint of law enforcement, particularly the Department of Public Safety and the Mississippi Highway Patrol. And I will also tell you, as you probably know, that we did send we did send some support to Washington because we were requested to do so. General Boyce could talk to that if you're interested, but we also have sufficient backup here should we need it in the coming days. Yes, sir.
Thank you, Governor. Sticking to the federal level, if I may, when Biden takes office on Wednesday, it's been reported that he could sign about a dozen, 10 to 12 executive orders. If one of those were about vaccine distribution, like getting FEMA more involved or more federal resources down here with the National Guard for distribution, would you accept that help to try to expand it, or would you want to stick to a state-only operation?
Well, first of all, if he signs an executive order which gives us more National Guard help, the only thing he could really do, to my knowledge, is he could increase the amount of money that the feds will pay for that. Because right now, with our, is it 502F funding, we're at 75-25, so we're paying 25% of that. So he can't deploy our Guard any more than we're already deployed, but he could help pay for what we're doing. You know, I found it interesting that in the plan that they've proposed, the latter part of last week, one of the things that they strongly recommended was state-run sites that were manned by the National Guard that was paid for by federal resources. We're already doing that, and maybe they saw the success that we've had by getting 30,000 shots in arms in the last 10 days. I don't know. But the other thing I would just say about the plan that was proposed, their notion of 100 million doses in 100 days. That sounds like a pretty big political announcement, right? I'll just tell you from a numbers standpoint what that means for Mississippi. That would mean that we got approximately 800,000 doses over 100 days, and that we put on average 8,000 doses in arms per day over his first 100 days. The problem with that is it sounds really good, 100 million in 100 days. We did better than that last week. We averaged more than 8,000 doses in arms per day last week. So we don't need catchy political slogans. We need more vaccine. And so I would submit to you that 100 million in 100 days sets a very low hurdle and very low expectations. And I'm hopeful that we actually get significantly more vaccine doses than what 100 million in 100 days would actually do for us.
Can y'all hear me?
Yes.
Absolutely. I want to say, start off by saying thank y'all for what you're doing for Mississippi and everything. But let me get right into it. Dr. Byers, this is just one question that I wanted to ask. One concern that some of the Mississippians were wondering down here in the South is a problem with expiration of vaccinations. Is that something that y'all have kind of looked at or maybe seen, vaccinations being expired with COVID-19?
So, no, that's a great question, and thank you for asking it. And if vaccines are stored appropriately, and, you know, there are some different storage requirements for each one of the vaccines, the Moderna and the Pfizer, then they are not going to expire for 6 months or longer. I think the biggest issue is, you know, once you access that vial, or if it's Pfizer vaccine, and once you take it out of that ultra cold storage that's required, you have a minimum amount of time to be able to get that dose administered. And, once you get the Pfizer vaccine out of the ultra cold, the clock starts ticking and you've got several days before you can administer it. And, once you access the vial, and remember, these are multi-dose vials. So a multi-dose vial of Moderna holds 10 doses of vaccine. For Pfizer, it's 5 doses of vaccine. But once you access that vial, then you've got to be ready to put that shot in those 10 people or those 5 people. And that's why, the plan of the mass vaccination clinics, like the drive-through clinics, is a model that works very well with this type of vaccine. Because once you get that access into that multi-dose vial, you've got to have those people ready to go and get that vaccine. And I think that's probably what you're talking about, and that can lead to some challenges. So one of the things that we encourage providers, that our external partners that we provide this vaccine to, is to be ready, is to have those folks lined up that you anticipate that you're going to give that vaccine to. In some cases, there may be an extra dose in that vial. There may be an extra dose of the Pfizer or an extra dose of the Moderna in there. So you need to be prepared. And if somebody doesn't show up, you need to have a backup list of people available that qualify for that vaccine, because one of the things that we do not want to let happen is one of those doses to go unused.
Thank you, Dr. Byers. And I'll just comment on that. It's one of the things I've talked with the health department a lot about over the last 2 or 3 weeks. I am not aware of any, on any scale, of any vaccine not being utilized in a timely fashion in Mississippi. And so, obviously, if our goal is to get 100% of the vaccines in arms that we get on a weekly basis, that means we can't have any of it go bad. And if we achieve the goal of getting appointments set, and then we can do that. As a reminder, if you're 65 years or older, there are appointments available. They are going fast as we speak, but there are appointments available for the week of 125, which is 1 week from today. Yes, sir.
Thank you, Governor. Dr. Paul Byers, this is another question for you, if I may. When I was interviewing some people last week, they were explaining to me a lot of rural areas felt kind of excluded when they were trying to get to destinations that were the closest. One woman down in Pike County, or the county, I think, just west of Pike County, actually. I can't think of geographics off the top of my head. But anyway, she said the nearest one was about 20 miles. So can you elaborate on these expansions? Are you reaching out to more rural Mississippi areas for vaccine distribution? And if not, just how can these people work to get there quickly?
Yeah, no, that's a good question. And right now we've started out with the sites that we have, to make sure that we have those sites geographically distributed so we can get as broad a coverage as possible. But obviously we need to move into the rural areas, and so there's several things that we've done. One of the things we're going to be doing is looking at additional sites. And we have a team right now that is exploring additional sites in more rural areas so that we can increase the access. But we've also provided doses to federally qualified health centers and some of the hospitals in more rural areas to make sure that we increase that access so that folks don't have to drive as far. But, unfortunately, that's one of the things that folks have had to do right now, but we're working on that.
Yeah, I would just echo what Dr. Byers said. 5,100 doses in speaking with Dr. Dobbs earlier today, and Dr. Byers is actually the one who did this, so he could speak to it a bit. But you see that 5,100 doses that was sent out today, by and large, went for more and more geographic diversification. We've got this balance that we've got to hit. We were behind the last 2 weeks, so we had to catch up. And to catch up, you've got to do larger super sites, which do a lot of individuals, while at the same time making sure we have geographic diversification as well. I will tell you, it's interesting that you mentioned Pike County. My grandmother lives in a county not named Pike County and was able to get her shot at Pike County drive-through site last week in the middle of the week. And so and I know I have a number of aunts that also don't live in Pike County that were able to go there. And so, yeah, driving 20 miles is a not perfect, but this entire scenario that we're working through is not perfect. The other thing is, as we open additional sites, and we will over time in other areas, remember it's a balancing act in ensuring that none of the doses go bad. We have to make sure we have an adequate number of appointments to make sure that that happens, and so we'll go with that. Yes, sir.
Yes, Governor, you mentioned our ranking. We used to be 50th, but now we're going up. Do you know where Mississippi ranks right now across the nation? And what does the federal government look for when they're looking to make extra allocations for states?
Yeah, so there are two ways to rank the states. One is based upon total number of inoculations per capita, and one is a percentage of the number of shots that are in arms relative to the number of shots that you have been given. Mississippi ranks in the low 30s, well, in the high 30s, in the 35 to 40 range in both of those categories right now. Just over the weekend, for instance, as I mentioned, I think in a social media post, we surpassed North Carolina and we surpassed Virginia over the weekend and several other states. And so we're in the 36 to 39 range. Again, making real progress. This should be a very good week for us as we get our partners in hospitals and private clinics have those 25,000 doses available. If they are successful in getting those first doses in arms, I can tell you the 30,000 that we have allocated to our state-run sites, they are all going in arms this week. So I know we're going to do that. And then these 5,100 that we've already sent out to our partners throughout the state, the additional 5,800 that we should get middle of this week will go to those facilities that are over 65%. They have a proven record of getting shots in arms. And so I think we'll have a very good week of first doses. We'll have a good week this week of getting the initial stages of getting second doses in arms. And then the next couple of weeks, there's going to be a big effort to continue to get second doses in arms because it's going to be time to do so. Yes, ma'am.
Lizzie Beveridge with the Clarion Ledger has a question.
Good.
Good afternoon. I wanted to ask about people trying to get appointments outside the state and vice versa, where people from out of state are trying to get appointments in the state. What do you suggest or recommend for people who are considering that? Because I have seen a lot of that on Facebook and stuff, and just wanted to know if you guys have addressed that or advice for them.
Well, I've only heard anecdotally of a couple of people that are living in Mississippi trying to get appointments out of state, and for those individuals, they were actually patients of an out-of-state hospital, and so the hospital had offered them an appointment. Because of that, they happen to be very high-risk individuals, but I haven't personally been alerted to any significant numbers of out-of-state people trying to get in-state appointments or in-state people trying to get out-of-state appointments. I certainly think 3 weeks ago there was an awful lot of people trying to get appointments anywhere, and they would drive anywhere, they would go anywhere, but I haven't heard personally, I don't know if anyone up here has, of that being a major issue either direction. Well, it appears that we've been here almost an hour and got a lot of good questions. We appreciate everyone. As I mentioned, we do have appointments available as of January 25 at our state-run sites. There are approximately now 30,000 first doses that have been distributed to our clinics and health providers. I'm hopeful we get all of the doses ordered and doses administered on the Department of Health website, as Dr. Byers said earlier, that they were working towards, so that everybody can have the same data I have, because we cannot fly blind in the distribution of these. We have to get them to facilities that get them in arms. So with that, thank you all for all of your help. God bless Mississippi. Stay safe out there.